It's painful for me to know that nearly every death we are seeing now from COVID-19 could have been prevented. I say that as someone who has lost 10 family members to COVID-19 and who wishes each and every day that they had had the opportunity to get vaccinated. I say that also as a concerned father of 2 young children who aren't yet eligible for the vaccine. But I know that our kids are depending on all of us to get vaccinated to shield them from this virus. Every week, I talk to doctors and nurses across our country who are burning out as they care for more and more patients with COVID-19 who never got vaccinated, all too often because they were misled by misinformation.
Surgeon General Vivek Murthy sharing his personal experience today as he issued a warning on the dangers of misinformation around COVID, calling it the, quote, urgent threat that continues to risk lives and drag out this pandemic. And Dr. Vivek Murthy, the U.S. Surgeon General, joins me now. Doctor, you spoke in very personal terms, and I'm curious. I would imagine someone like yourself, I think all of us had this experience, where you yourself have a extended network. You have family members and friends of friends that maybe come to you with questions about the vaccine or misconceptions about it. Have you had that experience personally as well?
Well, Chris, absolutely. I think all of us likely have been touched by misinformation in some way, whether we know it or not. And I, too, have had family members who have received videos or messages on WhatsApp or on Facebook or on other platforms, and they have questions about whether the information is accurate or not. I'm glad when they ask me. What I worry about is people who see information and assume it's true when at times it's not. And if that leads them to make decisions that are bad for their health, then they lose out and their loved ones lose out as well. That is what we are fighting against, Chris. Health misinformation is costing us lives. It's hurting us. This is not a new problem, but it has gotten far worse, aided and abetted by technology platforms.
I want to relay something that the White House Chief of Staff, Ron Klain, says that he told Mark Zuckerberg, and I'm quoting him here. He said, I told Mark Zuckerberg directly, when we gather groups of people who are not vaccinated and we ask them, why aren't you vaccinated? They tell us things that are wrong, tell us things that are untrue. We ask them where they've heard that. The most common answer is Facebook. That was him talking to Kara Swisher on Sway, which is her New York Times podcast. Do you guys have your arms around, like in any empirical sense or study data sense, where people are or are not getting misinformation?
Well, we've looked at some of the data, Chris, and what it tells us is that there's no single source of misinformation. It is coming from a variety of sources. Some of it is happening on social media platforms. Some of it is coming through videos that are being shared through text messaging platforms. It's coming through multiple sources. And that's why one of the issues that we laid out in the advisory and one of the calls to action that we put forward is one to individuals, to ask them to pause before they share on social media platforms or text platforms, to check the sources of the information they're about to share and ask, is it coming from a scientifically credible source? If it is, then it might be okay to share. But if it's not, or if you're not sure, then don't share. One of the most powerful things we can do to stop the spread of misinformation is to be more careful about what we choose to share.
You know, it seems that we still have 2 categories of people, and I just want to see if this jives with your characterization. The recent polling from Washington Post, ABC, 20% saying they definitely would not get vaccinated and 29% unlikely to get vaccinated. It seems that there's still low-hanging fruit, or at least there's still a huge chunk of reachable people, whether it's just not having the opportunity, or it's just low on their to-do list, or they haven't gotten around to it. And then there's people that are hardcore set against it. But it does seem like, is it your understanding there's a lot of people in that first category yet to be vaccinated?
Well, I'm so glad you asked, Chris, because if the numbers actually, to me, have a lot of good news in them. We have the highest vaccine confidence level about the COVID-19 vaccine that we've had since the vaccine became available. That's good news. It's happening in part because people are hearing from trusted sources. It's also happening because people know more and more people in their lives who have gotten vaccinated, and they see that they've done well. But there is still a group of people who are in the wait-and-see category, who are still nervous. Maybe they've been exposed to misinformation. Maybe they still have questions that they want answers to. Maybe they're not sure if it's still important for them to get vaccinated. And I will say on that last category, we've seen in some polls that about 50% of people who are unvaccinated believe that cases are so low right now during the pandemic that it's no longer important to get vaccinated. I want to say very clearly, it is still important to get vaccinated. We are seeing cases rise. We know that the cases and particularly the deaths are happening among people who are unvaccinated. 99.5% of deaths from COVID right now in the United States are among the unvaccinated. So I still believe there's progress we can make, but it's not going to be easy. We've got to work with trusted messengers. We've got to get information to where people are. We've got to recognize that everyone trusts the same people. And we've got to work through local doctors and nurses and others in their community to get information, life-saving information about this vaccine to people who need to hear it.